Each year, more than 3,500 infant deaths occur in the United States due to accidental suffocation, asphyxia, or other undetermined causes during sleep.
Years ago, 7,000 to 10,000 babies were dying every year of what was being diagnosed as sudden infant death syndrome, or SIDS. We knew nothing about why these deaths were happening, and we were telling parents nothing could have been done to prevent those deaths. In 1992, when Back to Sleep came out as a national campaign, and that is putting babies on their backs to sleep rather than their tummies, we noticed that the SIDS rates began to fall. By 1996, the deaths were cut by 50% since those early days. But the babies that continued to die were low income and often African American. So we did a study and discovered that 90% of those babies were found in unsafe sleeping environments. And we decided, could it be as simple as a baby doesn't have a safe place to sleep and that is why they're dying? So we began to put babies into safe cribs. And we called that campaign Cribs for Kids. Cribs for Kids has now grown to a network of hundreds of partners in every state in the United States, including Saipan and Guam and the Virgin Islands. And we are saving babies everywhere.
Cribs for Kids set out on a mission to prevent sleep-related deaths by educating parents and caregivers on the importance of practicing safe sleep for infants.
Originally, Cribs for Kids began as an education program. We felt that if we could educate mothers about the safest way for their babies to sleep, on their backs, alone, in a crib, then the baby would have a better chance of reaching its first birthday. When we discovered that a lot of parents couldn't afford a safe place for the baby to sleep, we decided to start providing those cribs to families. Over the years, we have been using the American Academy of Pediatrics guidelines. Also, in addition to that education, we decided that babies should sleep in the same room, but not the same bed as the mothers. So we needed a portable unit for the babies to sleep in. So we actually developed our own cribette, which is a portable play yard type device that actually has the safe sleep message embossed in the fabric of the unit.
Cribs for Kids has also created public safety initiatives designed to spread the safe sleep message throughout communities, such as Cops and Cribs and Operation Sleep Sound.
The Cops and Cribs and Operation Sleep Sound programs are part of our National Public Safety Initiative, which we work with first responder organizations and agencies to spread the infant safe sleep message and to educate the communities. And then we're also giving them the opportunity to provide a safe sleep space and environment by using the cribette.
Since most babies are born in a hospital, Cribs for Kids has introduced its National Hospital Certification Program.
In the United States, there are over 2,000 birthing hospitals. Cribs for Kids has hundreds certified. Our goal is to get all of the birthing hospitals in the United States Safe Sleep certified. Cribs for Kids was instrumental in getting Act 73 of 2010 passed, stating that all birthing hospitals in Pennsylvania would educate the parents and caregivers prior to discharge, prior to leaving the hospitals, on the importance of infant safe sleep. The National Certification Hospital Program was implemented in 2015. We piloted it.
Cribs for Kids has partners throughout the country that implement the infant safe sleep programs within their communities. All of the safe sleep materials are shipped from the organization's warehouse in Pittsburgh.
The orders come to us through the Cribs for Kids online store. You don't have to be a partner to order from Cribs for Kids. We have hospital, health departments, nonprofit groups, and we have single moms, someone looking for a pack and play or a crib. As far as shipping, we try to get the lowest price for our partners because the more we save in shipping, the more they can put towards buying a crib for a baby. So we have one group, Pitt Ohio Express here. They donate shipping in 14 states. Anyone can go to our website, cribsforkids.org, and all they need to do is complete the form, submit it, and once that's completed, they can start the processing. But we don't let paperwork hold up us shipping a crib out to a mother.
Since 1998, over 500,000 Safe Sleep survival kits have been donated to families in need throughout the United States.
Early on, we came up with what we call the Safe Sleep Survival Kit, and that includes our cribette, a Halo sleep sack, which is a wearable blanket, which not only keeps the baby at a good temperature, but it keeps blankets out of the crib to avoid suffocation. It also includes a crib sheet with a safe sleep message imprinted on it, and it includes the pacifier. Also in the Safe Sleep Survival Kit, we put a temperature card that really works. We list the safe zone on the temperature card, telling the mother exactly the temperature that room should be to make the baby safe. Also included are educational materials, and those materials are not just for the mother. We include education for the grandmothers and other caregivers that may be taking care of that baby. We also include a video in the package, and this video shows the mother's safe sleep practices and also tells the mother how to put our unit, the cribette, together. Because a lot of our educational materials may not be in the baby's room, or the mothers may not really look at them because they're getting home with a new baby and they're excited. We decided to put our safe sleep message on the cribette, which is ABC, alone on my back in a crib. That reminds not only the mother, but every caregiver putting that baby down to sleep exactly how the baby should be sleeping.
Cribs for Kids has changed the way parents and health professionals think about where an infant should sleep.
We're happy to report that we have hundreds of partners throughout the country who are doing our education, who are using the Alone on My Back in a Crib motto, who are buying our product, who are educating their communities. We're very fortunate because we have turned our nonprofit into a business. Even though we're a nonprofit, we buy product in large quantities. We sell that product to our partners at discounted prices. The money we make comes directly back into our nonprofit organization, and 100% of that money goes into programming that will help communities reduce their infant mortality rates by educating their mothers about infant safe sleep.
For more information, visit www.cribsforkids.org.